Before you begin the customization and application process for the circaid reduction kit lobe, the patient must be fitted and wearing his or her circaid reduction kit lower leg and upper leg components, as well as undersleeves. The patient's lobe may or may not be as exposed as shown, depending on the lobe's shape and size. Lay the reduction kit lobe on a flat surface. Cut along line A1 as far as the printed line indicates. Start by attaching the lobe kit side 1, where you just trimmed, along the posterior side of the lobe to the reduction kit upper leg component. Note that the orientation of the letters on the lobe kit, A, B, and C, may be reversed depending on the location and side of the lobe. Rotate around the patient and identify where the center of the lobe approximately is. Now, pull the lobe kit underneath the lobe towards the anterior side and cut along line A2 until you reach the point on the front of the lobe identified in the previous step. If you are unsure of how far to cut, start with small cuts and gradually adjust so as not to overcut the kit. If cutting near the patient's limb, be sure to use blunt-ended scissors for their safety. Lift the lower portion of the lobe kit underneath the lobe and reattach it to the reduction kit upper leg component with 2 pieces of hook tab. With the lobe now lifted, wrap the upper portion of the lobe kit around the lobe and attach it firmly with 2 pieces of hook tab. It should be applied firmly to apply compression. This portion may apply to the reduction kit upper leg component or the lobe kit itself, depending on the position and size of the lobe. If you have gapping along the anterior side as shown by the pen, readjust the posterior straps to account for the contour of the lobe. Fasten the straps firmly to maximize lift and compression. The posterior sections will likely overlap as shown by the arrow. If desired, the lobe kit can be further customized by trimming the length of the anterior straps or by creating additional straps. If the upper portion of the anterior section is too long, its overall length can be trimmed. Ideally, the straps will attach just past where the lobe ends, as excess fabric can lead to recoil and weaker support. For this patient, all necessary adjustments have now been made, and customization and application are complete. If additional straps are desired for contouring to the lobe, you can cut along lines B1, C1, B2, and C2 if desired. However, it is recommended to have as much of the lobe covered by a solid piece of material to provide maximum support and compression.